Hello, and welcome to learning the ABCDs of Medicare. As you approach your 65th birthday, the daunting task of enrolling in Medicare may seem like a giant maze. So many different turns which way to go. As you get closer and closer to your 65th birthday, your mailbox gets inundated with all sorts of Medicare flyers, Advantage and supplement plan quotes, people reaching out, offering their assistance, and you may look just like this couple, very frustrated and confused with Medicare and all the different parts. My name is Michael Matullo from groupbenefits.com. I'm a licensed insurance producer, and I'm very excited to take you through the A, B, C, and D's of Medicare today. Let's talk about the agenda for today's presentation. We're going to begin with a brief history of Medicare in America, when to enroll in Medicare, Part A, which is the hospital insurance, Part B, which is your medical insurance, Part D, which is a prescription drug plan. We're going to compare supplement plans versus Advantage plans. We're going to look at what's not covered by Medicare. And then lastly, we're going to go over your decision and next steps. Okay, a brief history of Medicare in America. Medicare is a social insurance program administered by the United States government. It provides health insurance to people who are aged 65 and older or who meet other special criteria. President Lyndon B. Johnson signed the Social Security Act of 1965 into law. Medicare operates as a single-payer healthcare system, which is insurance financed through taxes. When to enroll in Medicare? Well, you're first eligible to sign up for Medicare 3 months before your 65th birthday. Coverage always begins the first of the month. So, for example, if your birthday is July 19th, your Medicare effective date is going to be July 1st. Now, you may also be eligible to enroll in Medicare earlier if you have a disability, end-stage renal disease, or ALS. On the bottom of the screen is a sample Medicare ID card that will list your Medicare number and then your Part A and Part B coverage effective dates. Let's talk a little bit about working beyond age 65. So if you work at a company with fewer than 20 employees, you must enroll in Medicare Parts A and B immediately, as soon as you're available or eligible. The reason being is Medicare is now your primary coverage. If you work at an employer with 20 or more employees, you may choose to remain on that group plan. Now, you also have the option of enrolling in Part A for free. There's no cost, and we'll get to that later in the session, but some people elect to enroll in Part A when they become eligible at age 65, and then enroll in Part B when they retire from their employer. Now, if you do enroll in Part A, you can no longer contribute to health savings accounts. Enrolling in any parts of Medicare disqualifies you from future contributions into a HSA. Now, Medicare Part A, this is your hospital insurance. Part A covers hospital stays, home health care, hospice care services, inpatient care in a skilled nursing facility, and inpatient care in a psychiatric hospital. Now, there's deductibles, co-payments, and co-insurance for each services, and there is no maximum out-of-pocket limit. Something to note of great importance is that Part A does not cover custodial care or long-term care. Custodial care is non-medical assistance at either your home or in a nursing or assisted living facility with the activities of daily living, such as bathing, eating, and dressing. Now, as I mentioned just before, Medicare beneficiaries do not pay a premium for Part A if they've worked at least 40 quarters. Now, let's talk about hypothetical Part A costs. So, if you have inpatient care in a hospital, a skilled nursing facility, hospice, or home health care, days 1 through 60, you're going to be responsible for a deductible of $1,632. If the stay is extended beyond 60 days, days 61 through 90 is a $408 per day copayment. Beyond day 90, days 91 through 150 are an $816 copay per lifetime reserve day. Anything beyond 150 days, you're responsible for all of the costs. Medicare Part B. This is your medical insurance. Part B is going to cover physician visits, clinical labs, outpatient hospital services, preventative services, and durable medical equipment. Now, Part B has an annual deductible. In 2024, the Part B annual deductible was $240. After the deductible is met, Medicare typically pays 80% of the approved charges. Now, once again, there is no maximum out-of-pocket limit. Also, IRMA may apply. Now, what is IRMA? IRMA is the income-related monthly adjustment amount. IRMA is a sliding scale set to adjust the Medicare Part B and Part D premiums. Now, Medicare uses the information on your tax return from 2 years prior to determine IRMA. The higher the range of modified adjusted gross income, the higher the IRMA tax. Now, in 2024, IRMA applies to Medicare beneficiaries who have a modified adjusted gross income above $103,000 for an individual return and $206,000 for a joint filed tax return. On this slide, we're going to review the 2024 Medicare Part B premiums. So from left to right, the left column shows the different tax brackets for an individual tax filer. The middle column shows a joint tax return brackets. And then the column all the way to the right are the associated Part B premiums with the IRMA tax. So if you earn $103,000 or less, your total Part B premium as a single filer would be $174.70 per month. Now, as a single filer, if you earned $130,000, you would be in the third bracket. You would pay $349.40 per month for your Medicare Part B premium. Medicare Part D, this is the prescription drug coverage. All prescription drug coverage plans can be found on Medicare.gov. Medicare Part D, prescription drug coverage. You must be enrolled in Original Medicare to join a prescription drug plan. The reason being, you need a Medicare ID number to enroll in a prescription drug plan. Part D helps cover the costs of prescription drugs, including many recommended shots and vaccines. All prescription drug plans must cover a wide range of drugs, including protected classes such as cancer meds and HIV/AIDS medications. Part D plans can be found on Medicare.gov and are run by private insurance companies that must follow rules set forth by Medicare. The average national cost in 2024 for a Part D drug plan is around $34.70 a month. Now, IRMA may also apply to your Part D premiums depending on what your modified adjusted gross income was 2 years prior. Something very important to note is that lifetime penalties and lockout periods apply for those who enroll late in a prescription drug plan. So it's very important to enroll in a drug plan as soon as you become eligible. Okay, on this screen, we're going to talk about the Medicare Part D premiums. So just like Medicare Part B, IRMA may apply depending on what your income is. So from left to right, once again, it's the individual tax return brackets. The middle column is the joint tax return brackets. And then the column all the way to the right, that is the associated plan premium plus IRMA tax. So just as in Part B, if you earned $103,000 or less as a single filer, you will simply pay the plan premium of the drug plan you choose on Medicare.gov. If you earned $170,000 as an individual filer, you will pay $53.80 in IRMA penalty plus the plan premium that you choose. All prescription drug plans have an annual open enrollment period beginning October 15th through December 7th. This is your opportunity to join a plan, drop the plan that you have, or switch to a different Medicare drug plan. It's very important each year to review the prescriptions that you're on and the pharmacies that you like to use to see if there's a plan that may be a better fit for you. Now, the change of plan is always going to be effective January 1st of the next year, and you're unable to change plans outside of this open enrollment period. Once again, all the drug plans can be found. You can browse through the drug plans on Medicare.gov, and they have a great comparison tool where you can enter in the drugs that you're on, the dosage, the frequency taken to find what is the best fit for you. Okay, now this is when we're going to get into the thick of things. Medicare supplement plans versus Medicare Advantage plans. A Medicare supplement plan, as seen on the left, is exactly what it sounds like. You are supplementing the original Parts A and B of Medicare. So if you go the supplement route, you're going to have a Medicare ID card for Parts A and B. You're going to have a Medicare supplement card, and then you're going to have an ID card for your prescription drug plan. On the right, Advantage plans combine all of the aspects of Medicare and often include prescription drug plans. So you would have one card for everything. Medicare supplement plans typically have higher monthly premiums, but lower or no copays. Now, supplement plans offer a national network. You're actually using Medicare's network. So you're not choosing an insurance carrier's network versus another. If Medicare pays, the supplement plans will pay. So you have the freedom to go anywhere inside of the United States. There's also no required referrals when you choose a supplement plan. The one drawback to supplement plans is that routine dental and vision care is not covered. You have to buy an individual policy for both of those. And you also have to enroll in a prescription drug plan. Reason being, it's not bundled with a supplement plan. You have to get a drug plan off Medicare.gov. On the right of the screen is Advantage plans. Now, Advantage plans generally have lower to no premiums in terms of monthly premium cost. However, covered services have deductibles, co-payments, and co-insurance. Prescription drug plans are bundled with Advantage more often than not, but you're restricted to the Advantage plans network. And if you want to see a specialist, more plans than not require referrals. Now, what's great about these Advantage plans for those who only want one ID card is that the dental division, the drug coverage, that is oftentimes bundled. But if you're outside of your Advantage plan's network, only emergency services would be covered. So you're restricted to the Advantage plan network. On this screen, that's really what we're going to highlight. Side-by-side comparison. You know, the supplement plan does not have a network. If Medicare is going to pay, the supplement will pick up the remaining costs, and there's no referrals required. On the Advantage plans, referrals are required, and each plan has its own network. We're going to take a little deeper dive into the 2024 supplement plan. So most people are choosing Plan G, and the reason why is highlighted on the screen. Plan G picks up everything that Medicare doesn't pay other than the Part B deductible. Now, if you remember from the beginning of the conversation, the Part B deductible in 2024 is $240. So you're responsible in 2024 for $240, the supplement plan premium, and then the supplement is going to pay all of the charges that Medicare doesn't. And I'm going to show that to you on the next screen where we go through a hypothetical quote. So from left to right are the covered services, what Medicare pays, what this supplement plan pays, and then what you're responsible for. So for Part A, your hospital insurance, Medicare is going to pay everything up to anything beyond 365 days. Anything beyond 365 days in the hospital, you are going to be responsible for. Anything before that, Medicare plus the supplement plan will pick up. Now, if you end up in a skilled nursing facility, Medicare and the supplement plan will pay everything through the first 100 days. Anything beyond 101 days, you're responsible for. Medicare Part B, this is the medical insurance. Once again, from left to right, covered services on the left. Then the next column is what Medicare pays. The next column is what this supplement plan pays. And then the last column is what you're responsible for. So for all Medicare Part B services, you're only responsible for the Part B deductible of $240. Once that $240 deductible is met, Medicare is going to pick up the first 80%, then the supplement plan will pick up the remaining 20%, leaving you responsible for $0, only the supplement plan monthly premium. Now, which insurance carrier is the best for supplemental coverage? Well, the things that we take into consideration with choosing the right insurance carrier is the number of years in the market. So we want to find an insurance company that's not erratically changing their premium rates as you get older. We want a company with stability, and then we also want a company that's providing attractive premium rates, so someone that's very competitive. And then lastly, if you're enrolling with a spouse, maybe your spouse is joining Medicare later, we want to look at the carriers that are offering a household discount. So Cigna may be attractive to one, AARP may be attractive to another. It's ultimately your decision which supplement carrier to move forward with. Now, let's look at what it costs for an average 65-year-old male in New Jersey. So in this example, there's no IRMA tax applied. This is just an average enrolling 65-year-old male in New Jersey. So Part A, there's going to be no monthly premium. This individual worked at least 40 quarters, so there's no Part A premium. Part B, the base premium without IRMA is $174.70 a month. The Plan G supplement for a 65-year-old male in New Jersey on average is around $175 a month. And then the Part D, the base premium, this is no IRMA, The national average for a plan premium is $34.70, bringing us to a grand total of $384.40. What is not covered by Medicare? So Medicare doesn't cover any of the following: long-term care, routine dental or eye care, dentures, cosmetic surgery, hearing aids, routine foot care. Some of these can be addressed with individual insurance policies. For example, you may purchase individual dental insurance, you may purchase individual vision insurance, you may also look at long-term care policies. This provides a benefit for those who end up in skilled nursing facilities. They require assistance with the activities of daily living, even if it's in their home. So these are other policies that you may want to inquire about. I'm sure there's still a lot of questions. As you get closer to your eligibility date, please reach out to us directly. We're very excited to help you and help you enroll in Medicare Parts A and B. We'll help you review the supplement plan options, find the right fit for you, and then lastly, we're also going to help you review the prescription drug plans on an annual basis so that as life changes, we change with it. Looking forward to hearing from everyone. Hope you enjoyed this webinar. Have a great day.